And as we've been mentioning, we spoke with that renowned urologist, Dr. David Schusterman, last hour about President Biden's condition, and he claimed that Biden most likely knew about the prostate cancer prognosis for several years.
Condolences go out to Joe Biden and his family, but I have to say that in my expertise as a urologist, prostate cancer like this doesn't come on just overnight. This happens over a long period of time. To me, it seems very surprising that the first diagnosis would be a metastatic diagnosis, especially Gleason 9 cancer.
All right, for more medical expertise, we're bringing in U.S. Representative of North Carolina and urologist, Dr. Greg Murphy. Doctor, thank you for making the time tonight.
Thank you.
What do you make of what Dr. Schusterman just said there?
I adamantly disagree with it. You know, prostate cancer may have been there for several years, but for people to say this is a cover-up, let's get back to science. Let's not put politics and science like was done during the Biden administration. Either one of three things happened. Either his physician did not do a PSA or even a rectal examination. A lot of doctors are not doing rectal examinations when screening for prostate cancer now, which is wrong. Or possibly the president refused it. Some patients say, I don't want a rectal examination. To say that he has been diagnosed with this and it's being hidden, I think is wrong. We don't need to make that leap right now. The great thing is there are new treatments now. In the last 10 or 15 years, there have been wonderful treatments for people who have metastatic disease. But I think America needs to step back and stop making everything political. We know that the decline of his mental acuity in Biden was covered up. Let's not jump here to saying something that we don't know anything about as far as prostate cancer. I think that's a really objective way to look at it.
Okay. And even if there were no rectal exam, I mean, the PSA score is very standard for a man of his age. You would expect that even if that were not in the public health report, that he would have been aware of that number.
Yeah, but Natasha, this is one thing only urologists really get a hold of. You can still have a very aggressive prostate cancer, but have a very low PSA, so it's not abnormal. This is why a rectal examination is so important. It's because the cancer is so poorly differentiated, it doesn't even make this prostate-specific antigen chemical. Okay. So this is why you need both. And so this is why it's reckless to say that they've known about this for years. Let's be objective about what we're talking about.
Okay, really appreciate that insight you're bringing to the table. Let's talk about what we know then. Let's talk about the diagnosis here. Prostate cancer that has already spread to the bones, reporting a Gleason score of 9. What is the prognosis you're expecting here? What treatment options may be on the table?
So it's interesting that they've said it's, quote, hormonally sensitive. Either it is sensitive to the withdrawal of testosterone for the body or it's not. Most prostate cancers are, and the fact they've already said it's hormone sensitive means that they've known about this, I guess, for a little while, that he's responded to treatment so far. You know, I've seen patients, sadly enough, pass away in 3 to 4 months with this diagnosis, but I've also seen patients live 10 or 15 years. So it really depends upon how well he responds to therapy.
Okay, I appreciate that. How do you think this diagnosis needs to change, if at all, the way that the public has been discussing his potential cognitive decline over the last several years?
Yeah, I think it's true and unrelated. Unless someone has severely metastatic prostate cancer, meaning it's spread to visceral organs, not just bone, it's rare that it spreads to the brain. I think it's just two separate things that are going on. His mental decline, look, everybody saw it. Everybody denied it. Well, not everybody denied it. What's happened with prostate cancer is just two things that happen in men who are older. These things happen. 1 in 8 men are actually diagnosed with prostate cancer in their lifetime, but surely not everybody passes away with it. So these are things that I would say, you know, a normal 80-year-old is not screened for prostate cancer. But anybody running for the presidency of the United States should have had a PSA, a rectal examination, really to determine true fitness for the next term.
Yeah, PSAs are often not disclosed on these public health reports for the president. President Trump just did not disclose his. Do you think that given how common prostate cancer is in this country, that it should be disclosed regularly in these reports?
Well, I think definitely with these two individuals. I mean, we have two older gentlemen. PSAs, as we get older, tend to rise normally. So you have to put this in a really a good form to say, is this a rise in PSA just due to benign growth of the prostate, or is it due to cancer? But in somebody who is 82, I think that should have been known. I mean, I think, you know, let's get all the details out. Let's show that people are cognitively and physically fit to be president of the United States.
In terms of cognitive decline, is it possible, in your experience, even if it had not spread to the brain itself, that if he were undergoing any treatments, for example, say Lupron, it could affect his mental health, his mental decline?
Yeah, Natasha, there is something with that. There has been shown that there is some cognitive decline that occurs with this anti-hormone treatment, something called Lupron or Zoladex or one of the other things that shows some of the decline with that. But that is generally something that occurs after many years of treatment for it.
Okay. And we know in 2021 and 2023, health reports show that former President Biden was diagnosed with benign prostatic hyperplasia and also reported urinary symptoms. What is BPH? Are you gleaning anything unusual from that?
No, but BPH, benign prostatic hyperplasia, is just normal growth of the prostate gland. It affects almost 1 in 4 men over the age of 55. It's very common. They're not related necessarily to prostate cancer. If you have symptoms that lead to the diagnosis of prostate cancer, it is generally then advanced, either locally advanced in the pelvis or spread to the bone or somewhere else. So it's very common for men to have urinary symptoms. I still take care of patients all the time with this, but as a cause from coming from prostate cancer, it's usually a lot more dire, a lot more, the presentation is a lot more severe.
It's been interesting to track the narrative of this breaking news, even in the course of today. The initial gut punch, the shock of it, we're seeing the outpouring, the empathy on both sides of the aisle, which is wonderful to see in this moment in time in this country's history. And then we're already seeing the questions. How long did he know? How long did his circle know around him? What did this mean about his cognitive decline? What does this mean that he was still seeking office given a potential diagnosis like this? And also, what does it mean that this major book is coming out in 2 days that talks about his cognitive decline? What are you urging us as a doctor and as a representative in this moment?
Well, I think let's get the politics out of medicine. This is what has driven me crazy during the last 4 years, especially with Fauci and some of these other things, that we've thrown politics in what should be an objective science. You know, his PSA and everything could have been just entirely normal last year, and I've seen many patients all of a sudden where it shoots and skyrockets up. And so let's be observant about this. Let's be clinical about this. Let's get the politics out of it. Yeah, we can have the discussion about his mental decline because I believe that was politically covered up. Let's not do that with this prostate cancer because, look, it's something that happens in a lot of men and things can change quickly.
Okay. Dr. and Congressman Greg Murphy, really appreciate the expertise and time tonight. Thank you.
Great. Thank you.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.